Seniors never refrigerate these 5 medications, they turn toxic, and 4 you must refrigerate. Did you know that up to 10,000 seniors in the US are hospitalized every single year because of medication mistakes that happen right at home? That's right. Something as innocent as putting a pill bottle in the fridge can turn a life-saving drug into something dangerous or even life-threatening. In fact, a 2023 study from the Institute for Safe Medication Practices found that improper storage, including refrigerating meds that shouldn't be, was linked to a 44% higher risk of medication failure in people over 60. That's not just a number. That's someone's mother, someone's grandfather, maybe even you or someone you love. The scary truth is, your refrigerator might be turning your trusted medicine cabinet into a trap. Why does this happen? Because the kitchen fridge, the place you go for safety and freshness, can actually destroy the active ingredients in some of the most common medications seniors use every day. And the worst part, most people have no idea. If you think keeping meds cool is always safe, you're not alone. Pharmacists hear that myth all the time, but the science says otherwise. And if you think you can spot a bad pill just by how it looks or smells, think again. Some medications lose their power or become toxic long before you'd ever notice a change. In this video, we're revealing the 5 medications you should never refrigerate, and you'll be shocked at what tops the list. Number 2 isn't just the most common, it's the most dangerous, and it could be sitting in your home right now. At the end, we'll also reveal 4 essential medications that must be kept cold, because getting this right is not just about avoiding mistakes, but about saving lives. Before we begin, let us know in the comments below where you're watching from, and don't forget to like this video and subscribe to our channel for more videos like this. Now, without any further ado, let's get started with the medications you should never refrigerate. Number 5. Antibiotic tablets and capsules. Almost everyone, at some point, has been prescribed a course of antibiotics, maybe after a dental procedure, a bad chest infection, or a lingering UTI. It seems logical to keep any medication fresh by popping it in the refrigerator, especially since some antibiotics, the liquid ones, for children or those unable to swallow pills, actually do need refrigeration. But here's the twist. Most adult tablets and capsules should never see the inside of a fridge. Why? The temperature and humidity swings that happen every time you open the refrigerator door can turn solid antibiotics into a breeding ground for chemical breakdown. Take amoxicillin or doxycycline tablets as an example. These medications have a protective outer layer, but that layer is easily compromised by condensation. Once moisture seeps in, the active drug can start to clump, lose its strength, or even develop breakdown products that can upset the stomach or cause allergic reactions. The fridge can turn a safe, effective treatment into a gamble, making it impossible to know if you're taking the full dose or just a weakened shell. Even worse, some antibiotics form toxic compounds when they start to degrade, and taking these can make you feel sicker, not better. Ciprofloxacin, for example, is known to lose its power quickly in cold, wet environments, and studies have found that the risk of treatment failure doubles if antibiotics are improperly stored. Many pharmacists have seen patients return, frustrated that their infection didn't clear up, only to discover the real problem was that the medication was ruined by refrigeration. If your antibiotics come as tablets or capsules, keep them dry, at room temperature, and far away from the fridge, unless the label specifically says otherwise. Number 4. Oral diabetes medications. For millions of seniors living with type 2 diabetes, pills like metformin or glipizide are daily essentials, as routine as morning coffee. These medications help keep blood sugar in check, prevent dangerous spikes, and protect organs from long-term damage. But there's a big danger lurking for anyone who thinks cold equals safe for pills. Oral diabetes medications are specially formulated to remain stable at room temperature, and exposing them to cold or moisture in the refrigerator can cause the active ingredient to clump, separate, or degrade. Metformin, for example, can absorb moisture from the air, leading to a gritty texture, discoloration, or even a loss of effectiveness. That means your blood sugar could start creeping up, leaving you with unexplained fatigue, blurry vision, or constant thirst. In some rare cases, breakdown products of metformin can irritate the stomach or even lead to more serious complications. Even if your pills look the same, they might not work the way they should. There are heartbreaking stories of seniors ending up in the hospital because their diabetes spiraled out of control, not due to bad habits, but simply because their medicine sat on the refrigerator shelf instead of a dry, cool drawer. If your pills come in a blister pack, it's even more important to keep them away from cold, since opening the pack in a humid fridge lets moisture in. Always store diabetes pills at room temperature, tightly sealed, and avoid the temptation to keep them fresh in the fridge. Your health literally depends on it. Number 3. Nitroglycerin tablets. There's a reason why doctors and pharmacists are almost obsessive about how nitroglycerin tablets are stored. These tiny, fast-acting pills are a lifeline for people who experience angina, a type of chest pain that can be a warning sign of a heart attack. Nitroglycerin works by opening up blood vessels in seconds, rapidly increasing blood flow to the heart and stopping pain in its tracks. But here's the shocking truth. Nitroglycerin is unbelievably unstable, and the very thing that makes it a lifesaver also makes it vulnerable to destruction in the fridge. The cold, damp environment inside a refrigerator can quickly break down the active ingredient, rendering these pills almost useless. When the tablets absorb moisture, which is nearly impossible to avoid in the fridge, their chemical structure falls apart like a sugar cube in water. Imagine someone relying on nitroglycerin to stop crushing chest pain, only to find that the pill melts in their hand or crumbles into dust. Worse, if the medication has already lost its strength, it may not work at all in a true emergency. This is not a rare mistake. Every year, thousands of emergency room visits are linked to nitroglycerin failure due to improper storage. In fact, experts say that nitroglycerin loses its potency at an alarming rate if not kept in its original, tightly sealed bottle at room temperature. The bottle is even darkened for a reason. Light, heat, and especially cold and moisture all speed up the process of degradation. If you or someone you love relies on nitroglycerin, keeping it in the fridge could literally be the difference between life and death. Always follow the advice to keep it at room temperature, tightly closed, and away from any moisture, never in the fridge, bathroom, or anywhere damp. Number 2. Aspirin and other salicylates. Aspirin is one of the oldest, most trusted medicines in the world, famous for easing pain, lowering fever, and even reducing the risk of heart attacks and strokes. For many seniors, it's a daily routine, maybe with breakfast, maybe before bed. Because aspirin seems so safe and ordinary, it's easy to think it can be stored anywhere. But aspirin is a bit of a chemical diva. Its active ingredient, acetylsalicylic acid, reacts very strongly to moisture. And guess where you'll find the most sneaky, persistent moisture in your home? That's right, the refrigerator. Every time you reach in to grab something, tiny changes in temperature create condensation on anything inside. When aspirin absorbs this moisture, it starts to break down into acetic acid and salicylic acid. Not only does this process make the tablet less effective, but it also gives off a telltale vinegar smell, a sign that your pills are going bad. Even more concerning, as aspirin degrades, it can become irritating to your stomach and even dangerous if taken regularly. People often report stomach pain or heartburn and don't realize the root of the problem is not their body, but their pill storage. The breakdown products can cause ulcers or bleeding, especially in older adults who are more vulnerable to these side effects. If you ever find your aspirin tablets clumped, discolored, or with a strong odor, throw them away immediately. The safest way to store aspirin is in a tightly closed container, at room temperature, away from both heat and cold, in a dry place like a bedroom drawer. Not the fridge, not the bathroom cabinet, and definitely not anywhere damp. Number 1. Warfarin. Now, here's the most dangerous one on the list. The medication that's not only common, but absolutely critical for so many seniors with heart conditions, a history of strokes, or artificial heart valves. Warfarin is a blood thinner that can mean the difference between life and death, preventing clots that can block blood flow to the brain or lungs. But here's what's shocking. Warfarin is also incredibly sensitive to changes in temperature and humidity. Storing warfarin in the refrigerator exposes it to repeated condensation every time the door opens and closes. This may seem harmless, but even slight moisture can disrupt the delicate chemical balance inside each tablet. As a result, the actual dose you swallow could become unpredictable. Some days, you might get a pill that's too weak. Other days, you might get a tablet with altered absorption. For a drug as powerful as warfarin, which needs to be dosed just right to avoid bleeding or clotting, this is a recipe for disaster. There have been documented cases where seniors developed life-threatening bleeding, or on the other end, dangerous blood clots, all traced back to improperly stored warfarin. What's even scarier is that you won't notice a thing until a problem strikes. There are no warning smells or colors, just a gradual change in how the medication works in your body. Pharmacists and doctors always stress to keep warfarin at room temperature, away from light and especially from moisture. The risk is so high that some clinics actually do home visits just to check how patients are storing their meds. If you're on warfarin, double check your medicine cabinet right now. The fridge is the last place it should ever be, and keeping it there could be the most dangerous mistake you make this year. So, these were the medications you should never refrigerate. Now, let's reveal the 4 medications where refrigeration isn't just helpful, it's essential for your health and safety. Number 4. Insulin. Let's start with a medication that is a true lifeline for millions of people, especially seniors living with diabetes. Insulin. Unlike the oral diabetes medications mentioned earlier, which should never go in the fridge, insulin is a completely different story. This powerful hormone, which helps the body manage blood sugar, is actually a delicate protein that's incredibly sensitive to temperature. Here's the crucial fact. Insulin must be refrigerated before it's opened, and in some cases, even after opening if you're not using it regularly. The reason comes down to how insulin is structured. Picture it like a fragile snowflake. It's effective only when its proteins are perfectly folded. If left out in the heat or even at room temperature for too long, the molecules start to unravel and insulin rapidly loses its ability to control blood sugar. It might look the same to the naked eye, but once its structure breaks down, it becomes almost useless, or at best, unpredictable. What does this mean for a senior who accidentally stores insulin on the kitchen counter? Over time, the medicine will lose strength, and you could face rising blood sugar, blurry vision, unexplained fatigue, and eventually life-threatening complications like diabetic ketoacidosis. On the other hand, refrigerating insulin keeps it in its most effective form, protecting the delicate protein from both heat and bacterial growth. If you've ever wondered why your insulin doesn't seem to work as well as it used to, take a look at your storage habits. It's not just about following the pharmacy's label. Your health truly depends on getting this right. When you pick up insulin from the pharmacy, it's always stored cold, and it's best to get it home and into your fridge as quickly as possible. Always keep unopened insulin in the fridge, and once opened, check the instructions. Most types are good for 28 days at room temperature, but always ask your doctor or pharmacist for specific guidance. Even a few days in the wrong environment can make the difference between stable blood sugar and a trip to the hospital. It's a perfect example of how just a few degrees of temperature can literally save your life. Number 3. Certain antibiotic suspensions. If you or someone you care for has ever been given a liquid antibiotic, like amoxicillin suspension for a chest infection or a cephalosporin for a stubborn UTI, you've probably seen the pharmacist hand it over with a warning. Make sure you keep this in the fridge. Unlike solid tablets, which are generally best kept out of the cold, many liquid antibiotics are specially formulated to remain effective only at low temperatures. This has everything to do with how these medicines are mixed. Most liquid antibiotics are made up in the pharmacy by mixing a powder with water, creating a suspension that starts to degrade almost immediately at room temperature. In the warmth of a regular kitchen, bacteria and fungi can grow inside the bottle, and the antibiotic itself can break down into inactive or even harmful components. It's a little like leaving fresh juice on the counter. After a few hours, it's not the same drink at all. For these medicines, refrigeration halts the breakdown, keeping the antibiotic stable and effective for the entire course. If a bottle of liquid amoxicillin, for instance, is left out for even a single day, it can lose its power and fail to treat the infection. That can mean a longer illness, a higher risk of complications, and the possibility of developing antibiotic-resistant bacteria. Pharmacists report that liquid antibiotics are one of the most commonly mishandled medications at home, with parents and caregivers sometimes forgetting to refrigerate them, and then being baffled when infections stubbornly refuse to go away. If you're ever prescribed a liquid antibiotic, always double check whether it needs refrigeration and make sure it's stored in the coldest part of your fridge, never on the door, where temperatures fluctuate. This simple habit can mean the difference between a quick recovery and a lingering dangerous infection. Number 2. Certain biologic drugs. Now let's talk about a newer class of medications that are becoming more common every year: biologic drugs. These are cutting-edge treatments for conditions like rheumatoid arthritis, Crohn's disease, psoriasis, and even some cancers. Medications like Humira or adalimumab, Enbrel or etanercept, and several injectable cancer therapies are complex proteins created from living cells. Because they are made using biological processes, they are extremely sensitive to their environment. At room temperature or higher, biologics start to denature, which is a scientific word meaning the protein loses its shape and stops working, a little like what happens to an egg when you fry it. Once this happens, the medicine can't attach to its target in the body, and its effects are lost. That's why these drugs always arrive from the pharmacy packed in insulated containers with ice packs, and it's why every instruction booklet screams, refrigerate immediately. Failure to keep these medications cold doesn't just make them less effective, it can make treatment completely useless, costing thousands of dollars for a drug that no longer helps. And unlike some pills you can't just try it and see, many people won't realize their medication is ineffective until their symptoms worsen or, in the case of cancer drugs, their disease progresses. If you or a loved one is on a biologic, make it a habit to store the medication in the main body of the fridge, not the door, not the freezer. Avoid freezing, because that can destroy the medicine just as quickly as heat. Even short periods out of the fridge can ruin a dose, so be sure to only take out the pen or vial right before using it, and put it back immediately if not used. This is one of the most expensive and delicate categories of medicine in the world, and the right storage can literally make or break your health outcome. Number 1. Some eye drops and injectable medications. Rounding out this crucial list are certain eye drops and injectable medications that absolutely must be kept cold, or they'll lose their ability to protect your health. Let's start with latanoprost, an eye drop widely used to treat glaucoma, a disease that threatens the vision of millions of seniors. Latanoprost works by lowering pressure inside the eye, helping prevent blindness, but it's only effective when its active ingredient is fresh. At room temperature, this medicine quickly loses its power, and within weeks, it can become almost useless if not stored in the fridge. Seniors who keep their drops on a bathroom shelf often don't notice any difference until their next eye appointment, when they learn the treatment failed to protect their sight. The same is true for some injectable medications, including certain vaccines and epinephrine used for life-threatening allergic reactions. These medicines are so sensitive that even an afternoon in the wrong temperature can spell disaster. For example, epinephrine autoinjectors, like EpiPens, must be kept within a specific temperature range. While they don't always need to be refrigerated, they cannot be exposed to high heat or freezing temperatures, and some specialized versions do require refrigeration. Vaccines, too, are carefully transported and stored at just the right temperature from the manufacturer to the doctor's office, because a single slip-up in storage can make the vaccine useless. For these critical drugs, always follow your pharmacist's exact instructions, store them in the fridge if told, and never risk leaving them out on a counter or in a hot car. In the case of eye drops, some brands can be kept at room temperature only after opening, but always check the label, because the risk of vision loss is too high to take chances. For injectables, always return unused doses to the fridge as soon as you're done, and check expiration dates regularly. Your eyesight, your immunity, and even your life can depend on it. If you've made it this far, you now know something that most people, including far too many doctors and pharmacists, take for granted: the refrigerator is not always your friend when it comes to storing medication. So, here's your action plan. Go check your medications right now. Take 2 minutes to make sure that everything is stored exactly where it should be. Room temperature for most pills, the fridge only for those few that require it. If you're caring for an older family member, double check their medicine routine and set up a reminder to help them keep track. Now, we want to hear from you. Have you ever accidentally stored your medication in the wrong place or had a scary experience because of it? What happened and how did you find out? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.